Hi guys, حلقة جديدة من Absurde واليوم it's an episode you don't want to miss. It's about mental health. Mental health رح نحكي فيها كتير اشياء مهمة. Debunking myth, اشياء misunderstanding يمكن نحن كان عنا اياها او misconceptions عنا اياها عن الموضوع. It's really gonna be interesting ومعنا كمان which is making it even more interesting Dr. Diana Maatouk. Hi, Dr. Diana.
Hi, thank you for inviting me to this podcast and this subject that's very important to me.
Thank you so much for coming. It's really a pleasure for us. It is a really important subject. But before we dive in, let's just give a bit of a background about Dr. Diana. I wrote it exceptionally this time لأنه اسم الله على Dr. Diana قد ما عامل اشياء بحياتها. I had to write it down. So Dr. Diana holds a doctorate degree in clinical psychology from Montreal, Canada, where she worked and studied. She works with teenagers and adults, and she uses the psychodynamic approach in therapy. It's an approach based on psychoanalysis, and we'll know a bit more about it from Dr. Diana throughout the episode. She is also the founder of the Hummingbird Clinic here in Dubai, which was established in 2016. Dr. Diana, again, thank you and welcome. Let's start immediately by asking you the يمكن mainstream question. Why mental health do you think it's still a stigma? We see كتير عالم بتقولي لهم مثلا I want to see a therapist أما I don't want to see a therapist بيقولوا لك لأنه I'm not ماني مجنون I'm not crazy أو I don't need a therapist. ليه هالستيغما بعدها موجودة عنا؟
Because I think a lot of people still believe that it's a sign of weakness to go to therapy, depending on what they heard growing up from previous generation, that they think that, let's say, only people who have like serious issues, like, I'm sorry to use this term, like they're crazy, go to therapy. So there's this very bad, stigma surrounding going to therapy, like as if only people who are really unwell can go to, let's say, should go to therapy. And of course, there's a resistance when people decide to go to therapy because they have to fight these stigmas around them. But thankfully, it's changing with the presence of psychologists on the ground, on social media, on TV. It's become more, if you want, normal to seek support and regarding their mental health. So there's a wave of change that's happening, thankfully. I see less this resistance happening around us.
And yeah, we can say no, this is good that now social media and everything that's happening is helping, because we have a lot of things that's happening with social media and that's bringing negative stuff. So to know that this stigma is being broken because of these things is very nice. Something positive out of this.
صح. وبعدين مثل ما نحن we go see a dentist, مثل ما we go see حيلا نوع حكيم. I think this should be normal as well. كمان في ايام رح نعمل كل 6 اشهر نعمل فحوصات دم to see if we're well or unwell. This should be the case as well. I don't think we need to wait until we're unwell or there's like something major that broke us, so we can probably prevent as well this.
Speaking of this, maybe because you were talking about the blood test. We do it every 3 months, 4 months. About therapy, we don't really think of this because usually we don't see anything, we don't see any symptoms. So also my question is Dr. Diana, when do we think we need to start seeking therapy? Do we need to wait until we see any symptoms? Or why is it always like this? Like we need to see there's a pattern, we need to see that something has happened to seek someone.
Because there's a sense also of shame associated with the idea of going to therapy. Unlike seeing other doctors, like you mentioned, let's say a dentist or a bone doctor, this is more accepted socially than going to therapy. So because of that feeling of shame, people take more time to see, let's say, a psychologist. And it's quite sad because I've seen, let's say, people who are like, let's say, 60 years old, after they've made, let's say, their choice of partners, life choices, career choices that were not appropriate to them, coming to therapy. It doesn't mean that we can't work and on trying to improve, but you understand that 60 years of their life has passed already. So, like, I can imagine how things could have been different if the person had sought support much before, than going there. And regarding that, like when, let's say, I see a patient who also needs to take medication, of course, in that case, I refer to a psychiatrist. There's a lot of resistance as well regarding medication. Okay, that's another topic regarding medication, not only seeking therapy. I always give this image of let's say, imagine that you break a bone. Okay, you have an accident. So you need crutches, to support you and to help you heal in your process until you're able to walk again. So this is the same concept. You need support right now. Let's say someone who's unable to get out of bed, someone who's not able anymore to go to work, someone who lost interest in any social interaction with his environment, who lost interest in doing things or pleasure in doing things that he used to enjoy before. So in that case, therapy sometimes is not enough. Sometimes they also need an extra support with let's say, a medication. So that's where I use this example, of why is it okay to go and seek, medical treatment, yes. Yeah. And it's more difficult to imagine, going to see a psychologist or even a psychiatrist.
Also, it should be normalized like we do it. It's for our well-being. Mental and physical. Physical, we see the medical doctors. For the mental well-being, we should see a therapist. But Dr. Diana, some people consider therapy as expensive. It's super expensive. رح أقول لك تمام. أنا my personal opinion in this, and أكيد will hear it from you more لأنه you know what it takes to do therapy or to be a therapist. But in my opinion, we really all, or most of us, spend a lot of money on things that not necessarily get us any good, and we don't feel it. We should normalize spending as well on our well-being and mental well-being. But from a professional perspective, what do you say to people اللي بيقولوا إنه it's expensive?
Let's be clear. For some people, it's not even a choice to go to therapy or not. Sometimes it is a necessity. When someone has even the feeling that they're unable to even exist, or even below pleasure of living, like I mentioned it previously. So if they even feel that it's either they go and see a psychologist, or either, they're close to, let's say, death, there it becomes a necessity to go and see a therapist. Nice. So regarding the fees, it's expensive. It's expensive in many ways, actually. It's an investment of time. It's an investment of energy. It's an investment of money, of course. And the fees, they have a significance as well. If the therapy, let's say, was at a very, very, let's say, low price, some people wouldn't take it seriously. Yeah. And I believe that symbolically, the price they pay to go to therapy is actually the price they pay to acquire their freedom. It's a price they pay. It has to be a certain amount of money that they need to take out of themselves to feel that, first of all, they take it seriously. Because if the price is too low, they might miss sessions. They might, not take it seriously. They might think that it's not as serious,
And also, it might be actually cheaper than the price they will pay if they don't seek therapy when they need it.
True.
Exactly. So for me, it's really related to the fact that you need to pay actually in order to gain your freedom. It has a price to pay. Another reason is actually to become a psychologist. Okay, it took like let's say if you're someone who has a Ph.D, for example, it means like 13 years of studies, of sacrifice, of experience that you gain. And of course, the more you work, the more you acquire experience. So it's also a price people pay for the knowledge, you know, and the experience you've acquired. It takes a lot of discipline, it takes a lot of sacrifice. It's expensive as well to become a psychologist. So that also is the reason why, you know, there's a fee that is quite high. But we were discussing this, Gérard, about the prices can be discussed, you know.
A few packages come in. Some clinics, I think, or they offer packages.
It's part of actually when we do an assessment. I mean, I do an assessment in therapy. How I work, usually I take 3 or 4 sessions to do an assessment, okay? To try to understand what brings the person to therapy. We discuss their childhood, what they're suffering from. We assess sometimes the mood, the attachment, the type of attachment they have. And then we discuss the price of the session. So I personally, I don't know how other psychologists work, but I personally discuss the fees with them because I want the price to be, of course, reasonable for me, and I want them also to be able to afford coming to therapy. So if the insurance company covers, let's say, the fees, there's no reason why they cannot afford paying that fee, since they're going to be reimbursed. Now, if, let's say, they say, I don't have an insurance, and clearly they need support, so in that case, I discuss with them and agree on a price that's suitable for them and for me. And if even that is difficult, then I propose a package where really the price is much lower. So the idea is that actually it's therapy for all.
So when there is a way, there is a will, there is a way, like we say.
Exactly. And it's important, like as well for us as therapists, to accommodate everyone so everyone can come. But I repeat, the price cannot also be unreasonably low. It has to be a certain amount where they feel that they are spending, okay, not only financially, because between the sessions there's a lot of work that's being done. They analyze things, they have to take notes sometimes of the dreams they have.
Right.
We discuss some things. I always like to close, let's say, end the session with a question. For me, the questions are very important. This is what leads us to, by association, of course, to another topic, and then it opens other doors. This is how we explore, actually, things that they're not really aware of. You know?
So you said a few things that are very interesting to me as well, and I see it in many fields such as mine. When they say that your price is high, of course you're paying for the experience. People don't see that, and they just see that they're sitting 1 hour speaking to someone. Some بيشوفوا what happened behind the scene, what happened to you for you to get there, and for them to get the help they need, because those 13 years of experience, they're very important for that people to feel better.
So therapy, just to clarify, therapy doesn't happen only in the office. When the patient leaves, there's a lot of thinking regarding, I mean, on the part of
from
the
your
therapy.
end,
exactly.
Yeah.
There's a lot of reading, there's a lot of research. Analyzing, and there's supervision. I think as a therapist in private practice, like me, you cannot work alone. I mean, you always need a supervisor with you to discuss some cases, some difficult aspects of the therapy. And there's a lot of work being done outside of the therapy and from both sides. And I always tell people, what you get out of therapy is also how much you put in therapy. That's what I meant by investment, not only of money, of time, of thinking.
Time, energy, of course.
Because sometimes you have people coming and, I can ask, since the last time I saw you, did you think about something you want to discuss? And I tell you no. But in that case, I'm not going to do the work on my own.
Yeah.
And then I explain that this is something we have to do together. So, and you have people, on the contrary, they come and they have with them like a booklet, and they write like everything they thought about between the sessions.
Yeah.
And that investment is amazing. Like, you see how much they want to get out of the very difficult situation they're in. So it really depends on, actually, it's hard work from both sides, from the side of the patient, from the side of the therapist. So to close on that question, actually, it's not only someone sitting and passively listening to a patient in front of them. There's a way to listen. And we as therapists are trained to listen between the lines.
يعني الله يصبركم تتحملونا.
But like when you get to that point that you're comfortable enough to sit with someone, to speak with that person for an hour, like for me to get to that point, what does it take to start this process? What does it take to start therapy? Because for me it's a scary thought because of society, maybe. That's a very interesting question for me. Like, how do you start this?
You mean as a patient?
Yeah. Like when you myself, I want to start therapy, even though I have everything covered for me, which is the insurance. Even if I have all the means to go to therapy, what will I need? What would it take for me to start the therapy?
My first guess would be actually the pain. Because people, when they come to therapy, they've tried a lot, like different ways. Like, for example, they try to read books. But to my knowledge, books don't reply to you. because you need to... No, it helps, but
the ones you use before you sleep, you listen to, doesn't work.
Podcast, whatever. Listen, they do help, but it's not enough, because in order to grow and transform something inside you, you need another person, at least one person with who you can talk and analyze things. So yes, it does help reading books, but the problem is that it's very intellectual. And a good therapy, a good effective therapy, works at the level of the emotions. And that is how therapy works, actually. It's not intellectualizing, like, and for example, I have people coming and they know all the concepts and technical words of therapy, but you know what? Nothing changed. And then I, of course, nicely and progressively ask them to put aside these technical words and try to make it more personal about their unique personal experience, and put aside these technical concepts, because therapy should work at the level of the emotion, and for that you need another person. So another thing that I tried is not only reading and listening to podcasts and whatever, is to also try to talk to people around them. But some people around them, they're not trained to let's say, deal with their conflicts, okay? And then after that, they realize that it's not working. The pain is still there. And then, of course, with time, the pain increases. So what brings someone actually to go to therapy is the pain. It's not going. It's actually increasing. And the second thing, I think, is the courage. The courage to tell yourself, okay, I need support. I need support, and it takes a lot of humbleness. It means also, if you come from an environment that told you, that it's shameful to go to therapy, it's a sign of weakness, it's fighting the stigma.
And to open up as well. يعني اليوم بدك تروح عند therapist, you need to talk about your past, your present, about things you probably acknowledge that you did wrong, and it takes a lot actually to open up.
And what helps also people, to go to therapy is sometimes their friends or people around them already started therapy, and they see, let's say, the improvement. That definitely encourages them, to go to therapy.
So having a good circle of friends and having the courage is very important. But what saddens me, and sometimes that they need to feel a certain pain, or they need to feel something that happened to them to feel
before
that
they go decide
yeah,
to go,
for me this is a sad reason, but I mean this is what
That's
happens
how
in
it is.
society every day. So my case, I didn't feel any pain, but I felt like something was building up, and I felt like it was too much, and I was affecting the circle around me that is supposed to help me. So this was the driving factor for me that, okay, I should maybe talk to someone, because maybe it's not that they have a problem, maybe it's me, because they cannot just all react the same way, and I would blame them.
Sometimes, your circle can do so much. At the end of the day, your circle can support you today, tomorrow, for a week. But when there's a major problem, مشكلة بالأساس, it needs to be solved. Dr. Diana, question كمان. When we go to therapy, we expect probably immediate results, like maybe anything, especially nowadays. If we go to the gym, we expect immediate results, therapy as well. And I think it's a very long process. صح, or can it be short process sometimes? What should a patient going to therapy expect in terms of time, basically?
That's a very frequent question almost everyone asks. So to make it simple, it depends really on the approach and the type of therapy the psychologist uses. Like you mentioned, Gérard, that my approach is actually psychodynamic therapy, which is based on psychoanalysis. So it can be short-term, and it can also be open-ended, okay? So it takes more time, sometimes years. You have other type of psychologists, they use a different approach that is really like more focused on alleviating, let's say, symptoms mainly, which is not what psychodynamic therapy does. So depending on the type of therapy you choose, the type of psychologist, the different type of approaches,
timeline different.
Yes, but if there's one thing I always tell people coming to me, how many sessions do I need? It's impossible to determine the number of sessions for many reasons. First of all, you don't know since when the person is suffering from what brings them to therapy. You don't know actually also the personality of the patient. You don't know, how they take
they receive
the therapy.
They're willing to open up بسرعة.
Yes, and I think this is due probably to the society we live in. We want things to be fixed very quickly.
Yeah.
Unfortunately, if there is one thing someone needs to really understand when they go to therapy, is that they need to learn how to be patient. And a lot of patients will tell you, but I'm not patient. I said, well, this is something we will need to work on. Because
patients need to be patient.
Exactly. Patient comes from the word Latin, means patere. Patere means suffering. Okay? And to answer your question, what brings people to it's the pain to therapy. So patere, and also means like you need to be patient. It takes time, and therapy is a process. It's not, let's say you come 2-3 times and then the issue is fixed.
But also, like, if the patient expects quick result, it's not expecting it from the therapist. I mean, if you cooperate, if you tell your story, if you're honest, if you don't hide anything, as well, I feel like those things will be faster as a process. Whereas if you hide something and if you're just trying to lie to the therapist, it's gonna just drag it longer. So I feel like this is also when you ask this question to a therapist, you should know that this is coming from you as well, if you want to have a process that is faster.
Yeah. Dr. Diana, it sounded like an emergency. It's not. No, بس بدي أحكي شو حكينا شوي عن the process of therapy and what brings patient to therapy. And you mentioned the different forms of therapy and approaches. There's a new trend now, وعملنا عنها حلقة بكملها اللي هي healers and life coaches اللي هن أكيد بطبيعة الحال we all know منن therapists, منهم دارسين psychology, they're not even psychiatrists, nothing. So they're healers. Anna, in my opinion, which was very clear in the episode when we spoke about this, I still don't know, what they exactly do. But from a psychologist perspective, how do you see this therapy? So, Anna, can I اليوم decide إنه life coaching works for me better than therapy مثلا, and decide to seek life coaching instead of therapy?
But I think life coaching is a completely different way of working. Actually, I think from what I know, maybe I'm wrong, that they're mainly focused on strengthening, if you want, the ego, strengthening who you are, in the here and now, and how to overcome, let's say, a specific challenge. Okay?
It's targeted.
It's targeted, and it's really like focused on now. It does not go and dig into, let's say, early experiences in your life, like childhood and things like that, because this is for them, I think, not necessary.
Yeah.
Right?
مزبوط. وهون في سؤال. في عالم اليوم بيقولوا انه بفضلوا لايف كوتشز على ثيرابي لانه لايف كوتشنج بيقولوا لهم شو يعملوا بالفيوتشر, they plan ahead, يعني they plan the future and they don't need to go to their dig deep in their past, القصص اللي بتعذبهم او الميموريز اللي ما بيحبوا يتذكروها. Although I feel this is يعني مش كتير accurate لانه we come from the past. We need to understand our past. إذا في شيء زعجنا, we should solve it before we plan anything in the future. But what do you say about this? اللي بيقولوا لك إنه life coaching is better than therapy because they talk about the future, not the past.
Well, I think this is very reductionist because if you don't know where you come from, how do you know where you're going?
Mm.
I think because we are a continuity, I mean, who we are today, our identity, is constructed since even before we are born, how we were expected by our parents, our environment, okay? And on top of this, we hold, some transgenerational effects, that they go from generation to generation. And you come already with a lot of baggage. Yeah. So imagine saying to someone, just put this aside, let's focus on now and what's coming. I think it's like amputating a big part of your identity. And this is very different from the kind of work we do as psychologists.
Your approach is using basically talking about the childhood actor and understanding the childhood of your patients, صح?
Yes, so actually the specificity of psychodynamic therapy, which is the approach I use, it's based on psychoanalysis. It uses the concept and the theory of psychoanalysis, but it's just adapted in a different setting. So there's a very sad misconception about psychodynamic approach that it only focuses on the past. Well, I have an issue with that because it does not focus on the past. It focuses on how the past is extremely present in our actual conflicts today. For example, I grew up, let's say, in a very toxic family environment. And then in my relationships, I keep choosing partners that are very toxic to me because I repeat what's familiar to me. I repeat what I know the most, okay? So it comes from somewhere. It's a continuity. So for me, the unconscious doesn't know the notion of time. So we cannot talk anyways about the past. It's actually a time that I would call more actual. It's very active. It's very actual. So it's repetitive. This is a concept that's really at the core of psychodynamic therapy. So it means that this repetition is like essential. It's essential to highlight that pattern. So since it's a time, if you want, that we call actual, the main concern of psychodynamic therapy is not the past, is actually to create a past. It's actually to work on being able to put that past in the past in order for the person to not repeat anymore painful events and being more free and more in control of their choices today. So it works, the approach works mainly on creating a past. It doesn't mean because we talk of childhood, it means that the only concern is the past. There's not even the past. It's something very actual.
It's still present with you basically.
Exactly. It's very present. And actually the focus of psychodynamic therapy is the present. And the present, how do we know how it manifests itself? Also through the therapeutic relationship between the patient and the therapist. Okay? Because in that therapy setting in the room, the way the person interacts with the therapist is also interpreted. Because with the therapist, they also repeat the kind of relationship they had outside. Why? How? By it being very active. And we use that because this is probably how it's also happening outside. Okay, so we work a lot on emotions, as I mentioned. We work a lot on the early attachment, okay, that the person has internalized. We work a lot, we focus on dreams, we focus on the parts of the self that are still quite unknown to the person, and to make the person more aware, more conscious of their, patterns, and these conflicts reflect themselves in their actual difficulty.
Yeah. You mentioned كان بدك تقول شيء كريم.
Yeah, I wanted to say that the concept of life coaches are ridiculous to me. You cannot just forget your past and pretend that it's all gloomy and perfect from that actual day.
مظبوط. It will bite you back.
It will bite you back, and it will not solve any issue that you had beforehand that might bite you up again in the future. It's a baggage, as she said, Dr. Diana, that you take, that you have since your childhood, since you're born, since even before you're born. So you cannot just pretend that this has never existed and you go on with your life.
مظبوط 100%. I have كمان كما تقول شيء sorry.
Last thing regarding this, I think it's even dangerous to give this idea that anyone, no matter where they come from, whatever they went through, can become super powerful, can become achieve like even the sky is the limit. That's an issue because a lot of people, because of their own limitations, okay, they cannot achieve these things, so I think it's quite delusional to put everyone in the same basket, okay, and we need to clarify exactly what do they actually heal when they say they're healing and you can achieve this and you can. No, some people cannot achieve because they have limitations. Okay, and I think that's quite reductionist, and I think that's quite also dangerous.
Yeah, Dr. Diana, again we mentioned it بالحلقة قبل حلقة healing أو healers. Most, and I don't generalize, but most of the healers or like healers I know actually need healing, and therefore we named the episode Healers Who Need Healing. It's really, it comes to a point where it's ridiculous. We just cannot, claim that we heal, we do things that have specifications, have specialized people. It's beyond that, I think. ما فينا واحد يكون just بيشتغل بالماركتينج أو بيشتغل he's an engineer and تاني يوم to become a healer. You mentioned about diagnosing patients. إذا اليوم إجا عندك حدا وعنده مشكلة ما بيعرف شو هي المشكلة، بس في مشكلة بحياته is limiting him from doing what he wants to do. And then قلتيله عندك مثلا ما بعرف anxiety, you diagnosed him. معقول هيدا الشيء أثر عليه أكتر؟ يعني because now he knows what he actually is suffering from, makes him feel even like worse and have more anxiety?
Again, I'm going to reply based on my own personal experience, okay? I think that me as a psychologist, of course, I'm trained to diagnose. Of course, I am allowed to diagnose, but the way I deal with diagnosis is a bit different. Like, I will not give a label to someone because I think this is, I think it's quite violent to tell someone, let's say, you have a major depressive disorder. So the only positive thing about diagnosing is that if the person needs like medication, okay, in that case, it's not my role to diagnose someone. I can just refer them to a psychiatrist who's going to do that assessment, psychiatric assessment, and then provide the medication. Because in order to get
هلا رح نحكي بعد شوي عن the difference between
in order to get, let's say, treatment, medication, you need a diagnosis. In order to get reimbursed for insurance, you need a diagnosis. And by the way, most insurance companies, when they request a diagnosis, they want a diagnosis from a psychiatrist, not from the psychologist. It's not accepted. It's more the psychiatrist. So I separate things. When people need a diagnosis in order to get reimbursed for insurance or they need medication, I refer them to a psychiatrist. So I do diagnose. It doesn't mean that I don't diagnose, but I diagnose differently. I don't just label someone. Let's say you have anxiety. I explain, for example, the meaning of that anxiety. Because when you say someone, let's say, is depressed or anxious, it can be you, Gérard, or Karim. Both of you, let's say, can have the diagnosis of anxiety. But what does it mean about your story? Let's say the patient X can have anxiety about being abandoned because, let's say, in their childhood there was a traumatic incident where they felt abandoned at an early age. Okay, so we try to make links actually to find meaning to their personal, unique story. So you put this in a context of, their own story. That makes more sense than just labeling someone. Another person can have an anxiety of being persecuted. Yeah. Okay? And a third person can have a different type of anxiety. So it's very important to just put things in context based on their personal, unique story. That is a diagnosis. And for me, that's a diagnosis that's much more meaningful and actually touches more patients because you care about their story and they become curious.
Makes sense.
About their internal words.
Yeah.
Exactly.
For me, for example, I didn't know even that there is a differentiation between those two. Like even me as a patient, when I want to start therapy, I'm very confused. There are so many things, there are so many factors, so many divisions. And you mentioned something, and I'm curious now, what would be the difference between psychotherapy and psychiatry?
So
that's a very common question, I think.
Yes, that's a very frequent question. Like, for example, you can have, let's say, a patient calling the clinic to book an appointment, and when they come, they tell me, I want, let's say, medication because I'm unable to sleep. And then I have to explain that actually I'm not a psychiatrist. So I ask, do you know the difference between psychiatry and psychology? And then you need to, of course, it's part of our role as psychologists to also educate people. So you need to explain what's the difference. Of course, I refer them to see a psychiatrist. So psychiatrists, mainly, they studied medicine to start with, and then they did residency in psychiatry in a hospital setting. And then after that, they obtained, their degree in psychiatry. Some of them also are trained as therapists. So you have psychiatrists who also do therapy, so they do both, but they're trained for that. Now, psychologists is different, and psychiatrists are the ones actually who are therefore allowed to prescribe medication and to diagnose. Okay, psychologists also diagnose, but as I mentioned, like differently. So psychologists, no, from the beginning they studied psychology. Usually it takes 3 years to get a bachelor degree, and then depending on where you study, let's say if you're in the US or in Canada, you go directly from the bachelor degree to a Ph.D. degree or a Psy.D. degree or both. So, and that is like 7 years of studies. Before, let's say in 2016, 2006 actually, you still could do a master's after the bachelor degree, to become, let's say, a psychologist and have the title. Now it's not allowed anymore. In order to have the title of clinical psychology in the US and Canada, you need to have a Ph.D. degree. So they removed actually the master's in clinical psychology. It's replaced now by a master's in research, where you're allowed only to do research with your master's and not see patients. In other countries, it's different. In the UK, you can do that. So psychologists actually only mainly focus on, therapy or also research. Okay. You can choose if you want to be basically doing research or if you want to specialize in working with patients and doing clinic.
Yeah. Dr. Diana, you mentioned before what it takes for someone to start therapy. So حكينا شوي عن إنه واحد بده يكون جاهز to open up. لازم هو يكون willing to go, مش someone sent him. لأنه أكيد بالنهاية he will be dealing with the psychologist, he will be opening up, being honest about everything. So بده يكون مستعد يحكي بمشاكله basically and willing. وأكيد it takes كمان a skilled therapist. بس سؤالي إذا اليوم عندك skilled therapist، إذا أنا اليوم رحت عند skilled therapist وأنا I'm willing totally to do therapy, I'm very interested, very invested in this and I want it to work, can it still not work?
Two things to answer your question. Actually, it all depends on the relationship that the therapist has with the patient, okay, or they have together. Because one of the most important factors in therapy, aside from the technique used, is the relationship, the connection. If the connection is here, that's really like fundamental, okay? This is what really makes a therapy work. Some patients say, I saw a lot of therapies, but it didn't click. So they change, which is the right thing to do, because you need to feel comfortable when you go to therapy. Now, if despite that, there is a good alliance, therapeutic alliance that's in place, yes, there are aspects of the patient that can make the therapy process very, very difficult. Okay?
Like what?
Like, let's say, typically like a patient who has, a masochistic position. I think these are very difficult patients to work with, even if you're very skilled, okay? Because in their dynamic, it's quite paradoxical, because they come because they want to change, but at the same time they resist completely the change because they have this pleasure in showing that they're miserable.
Wow.
And this is also going to be replayed in the therapy setting, in a relationship. How? By proving to the therapist that actually, you see, I told you, no one can help me.
They come to feed on their pain.
Exactly, and it takes a lot of patience from the therapist. Sometimes the patient himself gets bored and leaves the therapy. Some can stay for a while, but really mainly to prove that they're miserable. There's nothing that can get them better, although you can clearly see that a lot of things have improved, but they don't want to be told, that there is a progress.
Wow.
That's wow, you have those people willing to do this effort for no result.
Pay money
and go to a therapist and spend time just to prove a point. This is something else. And you have those people and you have others who are really they're afraid to go. They don't want to be diagnosed, and even when they go at the expense of a company, they have this fear that the company might find out that they have been diagnosed or they have issues, and that's where what is this about? What is the confidentiality about the company and the patient? Do you have to say anything to the company? Do you keep it confidential? Would the patient feel comfortable going?
Sorry, أنا بس if I can answer from a patient perspective, when you reimburse it على company, you don't even go through the company. It's just between you and your insurance, and on the website of the insurance, you deal with all the papers. Doesn't even go through the company.
Yeah.
So I feel it's super safe. I also think إذا my employer found out that I have, let's say, a specific anxiety, let's say, and my employer found out, well, they need to find out and know, because they need to be also helping me in some ways in the workplace. So but nobody knows from work, and it's
But even if, let's say, this is of course confidential, but let's say someone calls and asks about a patient, but it's fully confidential, okay? But I believe that there is no such thing as full confidentiality. So when you see psychologists say, oh, this is fully confidential, and this is not true, because there are, I believe, like 3 situations where we need to break confidentiality. Of course, with the discussion with the patient. Okay, if I need to break confidentiality, I always need to inform the patient. This is the first step, to tell the person, like, I will have to, break confidentiality. So what are the 3 reasons? You have mainly a case of homicide. You have a case of, let's say, a patient who is, let's say, suicidal, okay? And they're about to really harm themselves. You assess the risk. You assess the emergency, because there's a way to assess suicidality. And then, of course, in that case, you need to tell the person, I cannot let you leave my office because there's an imminent danger towards themselves or towards someone else. Another reason would, if you noticed or you are quite worried that a child might be a victim of sexual abuse, physical abuse, psychological abuse, a child is in danger. Our role is to make sure that we protect the well-being of children because they're vulnerable. So it's our duty to make sure that they're safe. So that is another reason why we need to break confidentiality. Again, informing the patient, okay? And the third reason is mainly if the court asks to have access to a file, okay? Then we need to disclose the information.
And I think the patient does sign, if I'm not mistaken, on these, so they know, it's not...
Yes, on the consent form. The consent form, either you have a document that they sign before their first session, before they start therapy, they need to agree on this, so they know that these are the 3 reasons why we might break confidentiality. It can also be a verbal agreement, but they're aware. We make sure they're aware of this. There is no such thing as full confidentiality.
Right. Okay, that's interesting. So technically, it's confidential
until there is something very
until
bad.
There's something very dangerous where it shouldn't be confidential. Dr. Diana, I want to شوي move أو talk شوي about social media. اليوم بنشوف كتير on social media, and it's something شوي I find it super absurd صراحة. إنه we find a lot of jokes about mental health. بمعنى هودي memes, that people share. مثلا on Monday I deal with work and my anxiety and my dog. يعني حتى even lame jokes, and I don't understand what's the idea of these jokes. The thing is, we're normalizing being mentally not okay, but we're not normalizing this as much as normalizing actually seeking therapy. So اللي بيصير إنه we're شوي كمان عم نخفف من قيمة مثلا the mental illness. يعني لما تقولي anxiety, مش كل واحد عصب in my opinion شوي أو تضايق أو هيدا صار معه anxiety, ومش كل واحد يمكن خاف من شغلة صار معه فوبيا, مش كل واحد بحب يزبط بيته عنده OCD. هول الكلمات اللي كتير نستعملهم على السوشيال ميديا very هيك casually. Don't you think شوي بيسخفوا شوي من ال actual people who have these diseases, أو مش diseases is an absurd word. Issues, exactly.
Yeah, I think it banalizes, it minimizes, because they have certain criteria that you need to make sure the person has in order to diagnose, let's say, someone with anxiety. And it is a serious difficulty. It is painful. And the same goes with the trauma. You can have someone just, I don't know, something simple happened to them. They said, I'm traumatized.
Yeah,
so it's either banalizing or dramatizing.
Yeah.
You know, both of these. And there is also something I think it's important to discuss about wrong assumptions that social media shows. For example, when they say, I see it very frequently, like, and I don't understand how this is possible. Like, you need to, let's say you go through something difficult, you need to forget and move on. Or the concept of forgiveness. You know, it's so, you see it everywhere. You need to forgive. You need to forgive.
All the motivational talks وهيك.
Forgive. You cannot, get better if you don't forgive. Now, no one tells us how to forgive, but it's just like forgive, okay? And forget also. That's the best part. Forget. Now, forget what and how to forget? I have no idea, because I think this is really like absurd. I think this is quite, ridiculous, because nothing we go through as human beings goes away. Every single experience we go through, even the ones we do not remember, actually, especially the ones we do not remember, they leave traces. They leave traces physically in our body. They leave traces also psychologically. Okay, so forgiving is a concept that I have a very big issue with, on how it's banalized. Actually, forgiving is for me more about grieving. Okay, why? Because you acknowledge a harm has been done. You acknowledge that you need to process. You acknowledge that it takes time, and they're very linked for me with grieving. It's acknowledging, it's not forgetting. It's acknowledging, and it's understanding the pain that was caused. It's going through the pain that was caused, and it's going through the 5 stages of grieving.
مظبوط. Dr. Diana, I think this is really interesting. Thank you so much على كل information اللي قلتيها. I think in today's world, where we normalized a lot of absurd things and we just deal with it as if it's totally normal, the only thing that we really should normalize is seeking mental health, or taking care of our mental health. وكمان بالنهاية, we're not just harming ourselves. If we don't, we are harming people around us. وthere's also وقت كنا عم نحضر للحلقة في quote قلتي لي عنها that's amazing, from a book I think called the Book Thief. It says, I'm always finding humans at their best and worst. I see their ugly and their beauty, and I wonder how the same thing can be both.
Because we as human beings have good and bad, beauty and ugliness, and we need to learn how to navigate between these two aspects. And this is the complexity of us as human beings.
Amazing.
Thank you, and I hope you guys enjoyed this episode, and please don't forget to subscribe.